Dr. Yager, subliminal therapy is so widely applicable.
Yeah.
And a key feature of subliminal therapy seems to be that it works so quickly. So would you address why, basically? And maybe give us examples of, say, depression, cigarette smoking, etc. How long it takes to treat these things on average.
When the patient engages that higher level of intelligence that I've been talking about, the patient is capable of doing so much more than they can do consciously, and so much more rapidly, that I, as the therapist, after training, teaching that higher level of ability how to do the work, it's largely a matter of me stepping out of the way and permitting it to happen. After being trained, it's as though okay, I can handle it now. Get out of my way. You're confusing me by asking all these questions. Initially, however, it's a detailed step-by-step protocol.
Mm-hmm.
And in some problem areas like phobias and behavioral problems, maybe a compulsive behavior, something like that, just a very brief time is required, whereas sometimes you get into depression. You have so many active elements that have to be resolved that it takes more time, and the extreme of that is weight control.
Okay, so if I gave you rapid fire a list of psychogenic illnesses and other issues that I know you to treat, would it be possible for you to answer me 4, 5 on average? Would you be able to do that?
Yeah.
The average number
so.
of sessions for each thing. Okay. All right.
Let me define a session as an actual treatment session as opposed to the initial intake session.
Okay. Mm-hmm.
In the case of a simple one, like I mentioned, phobia, simple behavior, something like that, 2 sessions that probably take care of it.
2 sessions for
2
phobia.
1-hour
Okay.
sessions.
Okay. Cessation of smoking.
In the case of smoking, 2.
Okay. Weight control.
It's a very wide range.
Okay.
It could be as brief as 2 or 3 sessions.
Okay.
On the other hand, it could be, depending on how complicated it becomes, could be 10 or 15 sessions.
Okay. Hand washing.
2.
Hair pulling.
Maybe 3.
Nail biting.
2.
Arguing with your spouse.
Subliminal therapy might well not fit in that situation.
Okay.
It depends.
Okay. Insomnia.
Range 2 to 5.
Generalized anxiety disorder.
2 to 5.
Narcissistic personality disorder.
2 to 10.
Night eating.
That's right.
Night eating.
2 to 15.
Nightmares.
2.
2 sessions for nightmares.
I think that'd probably be the average of the ones I've treated.
And that's fantastic. Selective mutism.
2.
Dissociative personality disorder.
5 to 15.
Obsessive compulsive disorder.
2 or 3.
Repetitive job loss.
Repetitive.
Job loss.
5.
Wow, we've really covered the gamut here. So it seems to me that just about any illness or problem a person has can effectively be treated with subliminal therapy in a very brief period of time compared with traditional psychotherapy.
Yes, provided the problem is psychogenic.
Understood. Okay. Well, thank you, Dr. Yager.
You're welcome.